We begin tonight, though, with the blitz to treat COVID-19 patients in our state's hospitals. There are nearly 3,000 of them.
The doctors and nurses who battled to save lives early in the pandemic are overwhelmed again. Tonight, we're hearing from frontline workers at Cone Health. They shared their stories with WFMY News 2's Alma McCarty.
Inside the medical ICU at Moses Cone Hospital, nurses Frei and Kimberly Jenkins aren't having those tough conversations with their patients, the ones where they express their regret for not taking the COVID-19 vaccine. That's because those they are treating are already too far gone.
I'll be very honest with you. I haven't had the opportunity to because all the patients I've cared for are on ventilators.
They don't really say much except help me. They're all like gasping for air or confused or not like coherent at all.
The number of patients here and in hospitals across the state continues to surge. After more than a year of treating patients, the new wave of patients is upsetting, frustrating, absolutely exhausting.
A little bit of PTSD, deja vu.
Despite their best efforts, they're unable to save the vast majority on ventilators. The patients, generally younger, unvaccinated, and even more sick this time around.
We are frustrated because it's preventable. The vaccine has proven that it works. There's a lot of sadness that comes along with it. There are many days where I go home and I just cry. And we cry because we give so much of our lives here, our emotional lives, our physical life, our mental life, to care for other people. We're nurses because we love to care for other people.
The hardest, absolute hardest thing is the families can't be there. They can't come in the room. They can look on a TV screen at their patient dying, and I have to be with them because I don't want them to die alone. So I hold their hand. I cry with them.
Their hope is that people see these trends and react and get vaccinated.
I wish I could put a GoPro on my head and just go for 12 hours in the COVID ICU. To the people that don't want to get vaccinated or are scared, I think they would change their mind.
But I would just really love if people could kind of think of it as a whole. Like, we're all in this together. Let's kind of do this together.
Cone Health is making contingency plans if hospitalizations keep rising by converting about 120 rooms for COVID patients.